For more than 20 years, CTV has captured the moments that matter in our community. From our studios in St. Clair, you're watching Focus with Paul Dingeman.
Well, welcome to another edition of the Focus program. My name is Paul Dingeman. We are glad you are along. Lots of information for you today from Dr. Mercantante from the Health Department, and then also Tom Kephart, the Admissions Director and Marketing Director of SC4. But let's begin with Dr. Mercantante. Welcome to the Focus program. Nice to have you, Doctor.
Thank you.
Why don't we start out and sort of give an overview of the current status of the county? Where are we at? How are we looking?
I would say that we are stable. We were seeing a very rapid increase in cases, and in the last week or so, particularly in the last several days, we've seen a slowing of new cases, slowing of hospitalizations, and quite honestly, we're hoping that this is a signal that we can maintain a slow, steady control of the transmission of the virus. I think it's primarily due to the stay-at-home orders. People are avoiding each other, but it does show that it works, so that's very encouraging.
Yeah, it is encouraging. There was certainly a lot of controversy yesterday and the day before with happenings up in Lansing and pros and cons of that. But you see it on the front line, where you see with the social distancing, the numbers are starting to come down.
And nothing else has changed. The virus is still around. It's still highly contagious. That is the only thing that's changed. And we were quite honestly expecting a big surge this week. Looking at southeastern Michigan, we were right above it. We were just kind of waiting to get hit, and we very slowly, gradually saw a steadying off of that. I'm hoping it'll continue, and if it does, we'll see what happens when we start to reopen. But I would attribute this to the fact that people are avoiding each other. Yeah, and as difficult as it is, lifestyle is important, but human life is equally as important.
Very much, even more. And it's nice to see that people are starting to wear masks as they go into grocery stores and wearing gloves. And those things really work.
Well, the more we learn about the virus, the more we can help people understand how to take care of themselves. And we do understand now that there is a fairly substantial amount of transmission of this virus before you have symptoms. So when you wear a mask, it does protect other people from you. We're not so sure how well it protects you from other people, which is why you still need to be careful. But wearing a mask when you're out in public is a human service to other people. It is, in case you are transmitting virus and don't know it, it reduces the amount of virus that you're spreading around. So I would advise wearing masks in public. It's just the right thing to do.
And it's easy. You get used to it like anything else, like putting a coat on, putting gloves on. So it's something that we can get used to. You read in the newspaper and on the television that some of the major hospitals are laying a lot of people off. What's the condition of our local hospitals?
That's really interesting. Quite honestly, we're slow. Now that people aren't out and about and doing all the things they do, our hospitals are slow. Our EMS workers are slow. Our physicians are slow because we've been encouraging them to do telemedicine and televisits. And it's interesting that now that we've all pulled back, that our healthcare system is in fact ready to take a surge, but there's no patients there. It is curious to me. It's going to be interesting to look back and say, well, is this an indicator of how much we provide maybe too much health care in a normal time, But yeah, it's been an interesting phenomenon for sure.
So if you've got a broken leg, if you feel some chest pain, should you go to the emergency room?
Yes, you should. And, we really talked about making sure you don't go because we didn't want the hospital to be surged. But right now, and I would think even in the course of responding to surge, our hospitals are well prepared at this time to screen you appropriately and making sure that you aren't going to expose, if you do have COVID, that you're not going to expose their staff or other people. And I would absolutely say it's safe to go to your emergency room. In fact, in many cases, it's the only way you're going to get direct care, especially if your physician isn't seeing a lot of patients in person. So I urge people to go. Don't stay home and suffer. it's working. The system is working, and it's open.
There's certainly some horror stories about how debilitating the COVID-19 is to people. How their breathing is affected and their muscular pains and aches. It's an amazing disease, isn't it?
Yeah, we have a lot to learn. When it was first came out of China, we were understanding that the vast majority of cases were mild or very minimal symptoms, and I would suspect that that's true. But the people who are affected fairly well do report a pretty significant amount of symptoms, and it's not a 2-day disease. It seems to be a fairly prolonged course, at least a week, if not more. And so I think you'll know if you're real sick, you need to, get diagnosed and treated for sure.
Status of long-term care facilities. How are they faring during this? I know most of them are locked down.
So far, so good. Again, we've been talking to them pretty regularly. They report daily now to a state system on both their availability of PPE or personal protective equipment, as well as the number of cases that they're taking care of. All of our facilities have plans in place to take care of COVID patients. Many of them do have COVID patients, but they have infection control measures in place, and they're so far so good. They're doing well. In other words, we don't have an explosion of cases in our facilities. And the staff is well protected and seems to be doing pretty well for now.
So speaking of well protection, is there enough PPE equipment and ventilators in the county?
Well, our ventilators are what we've got. I believe we have approximately 40 ventilators, and we'll probably not get any more until we need more, because ventilators are being prioritized to areas that are having a surge of cases. And right now, we have enough ventilators. We have more than enough ventilators for people who are needing them. PPE, we're holding our own. Again, it's hard to say if this goes on for a long, long time or if we have a big surge, how we'll do. But all of our systems have been actively trying to accumulate and preserve and prioritize their use. And I would say there is no one that I'm aware of right now who has an acute shortage, who can't maintain the appropriate management of their staff and their patients.
Well, thank you for what you're doing and all the health care people in the county. It's just wonderful that we've got you and your staff to keep us informed and to stay on top of this issue. Thanks for your time.
Working hard.
Thank you. Thank you for your time
today. And we'll
keep
working hard. So thank you.
See you soon. Talk to you soon. Thank you. Well, Dr. Mercantante is certainly on the job, and we appreciate her giving us time today. We got some good news coming up in our next interview, so make sure you stay tuned for that. Well, welcome back. We've had an awful lot of really difficult news in the last few weeks, and I read some things in the Times Herald and heard on the radio some great news about St. Clair County Community College. Let's check in with the Director of Marketing and Admissions, Mr. Tom Kephart. Welcome to the Focus Show, sir. You've got some good news.
So, yeah, we've had some very good news. Despite all of the changes that have been going on, as alluded to, excuse me, there's some good news at the college as well. Fall registration opened on Monday of this week, the 13th of April, and so far demand has been good. People are interested in registering, which we're happy to see. We have made some changes with that for fall to make it a little bit easier. Our normal procedures would be that new students coming in would need to see an advisor, and then they usually do placement testing. But because our advisors are working very hard remotely, but it's harder for them to see as many students, and our testing center is closed right now. So rather than make people wait for that to reopen or come up with some other solution, we have come up with some ways for students to do what we're calling guided self-placement, where they can use grades from high school. If they took the ACT or the SAT, or they already took a test with us, they can use those scores, and various other ways that they can determine what classes they should be in rather than being held up with that. So the fall registration is underway, and we are prepared to help students get ready to go.
Well, you've really done some wonderful things. It's exciting, and I know that there's, if they register before the 15th of May, there is no charges?
That's correct, and that's the way we usually do it. If a student wants to go ahead and get registered, there's no down payment. The payment date is in mid-May, where they have to either have financial aid arranged or make a payment plan. We have one that's available for students, and then that holds their classes through to the beginning of the semester in late August. So it's a great opportunity for students to get in and get registered and make sure that they've got the classes that they're looking for the fall.
SC4 has always been a smart decision, as it says in your public relations release here, one that'll help you go anywhere. And the tuition is affordable, flexible, high quality education. It's just a good decision to make and try some education on a local level before you go someplace else.
It is. Most students, especially if you're going to be transferring to a four-year school eventually, there are certain courses that are they're labeled different things at different schools, but basically it's general education, some English, some social sciences, some hard sciences like biology or chemistry or physics, and other areas that every school is going to require you to take those, including SC4 for an associate degree. But if you get those courses done at SC4, the cost is quite a bit less. Our tuition is anywhere from a quarter to a third of what a typical four-year school would be, and that's a public four-year school. And usually the class sizes are quite a bit smaller as well.
Well, let's shift the gears here and talk about this $1 million fund that was created to help SC4 students. What's that all about?
Well, that is very exciting. It's not every day you get to say we've got $1 million to give away.
Yeah.
And it is money that's coming from the federal government primarily. Pretty much every accredited school in the U.S., as part of the CARES Act that was passed a couple of weeks ago by Congress, they included money for higher education. A certain amount was they had a formula and they came up with a number for each institution, and half of that money, and at SC4 that was just a little under $2 million total, half of that money is expected to go directly to students who have been impacted by the COVID-19 situation. Maybe they lost jobs, maybe their family members lost jobs. And so they're presenting hurdles to them or barriers that would keep them from being able to be in college. That could be, I can't pay my rent, I'm about to be evicted. If I'm homeless or I'm not in the area, I won't be able to continue to go to school. I need food. I need repairs on my car. I don't have internet service.
Wow.
I don't have a computer that works for these online classes. There's a lot of different reasons why students might be facing particular hardship right now because of this, and that's what this money is intended to do. Give them an opportunity to request some assistance so that they can get those things taken care of, and they can keep going to school. They can keep trying to pursue their degree or their program.
Well, I think it's so important to try and help students, especially at this time. And what a wonderful, wonderful program this is. All you've got to do is go to sc4.edu/cares, right? Is that the address?
That's right. We wanted to make it as simple as possible. On that page, there's a brief explanation of where the money comes from. About $950,000 of it is from that federal CARES grant, and then we added some money from some emergency and supplemental funds, just so we could round it up to $1 million. And it's a very simple form to fill out. The people do need to, whoever fills it out, they do need to be a student at SC4 who is currently enrolled for either the winter semester, the summer semester, or this fall semester. And then it just asks, what happened? Is it, it's like check boxes. I'm unemployed now, or I'm taking care of additional family members and there's additional expenses. Whatever that is, they can check those boxes, a brief explanation of why they need some funds. And then there's some choices like $250, $500, $750, $1,000, or other, because some people may need a little more than that. Some people may need less. They may say, I need $50 so I can get an internet router or a hotspot. So we want to be able to react to what people are needing right now, so that they can stay in school. Is it a one-time grant, or is it a continuing kind of a grant? Do I get money every month for 5 months, or it depends? It is. It's kind of this is brand new. I mean, we're literally figuring out exactly how we're going to do it as it goes along. We do want to give away all the money, and so we'll just have to see what the demand is on it. Certainly, if a student had, they need rent money for this month, and then next month the situation hasn't changed and it's still going to keep them out of school if they, if they don't pay their rent again, then they could reapply, and each request will be considered as they come in. It's really just limited by the amount of money that's in the fund. And, we do these kinds of things on a regular basis. I mean, we have students who face these situations, and through the community foundation, with our own funds, we try to do what we can, but we're usually talking, $50,000 to $100,000 a year that we're trying to do that type of stuff. To have this amount of money, it will have an impact, obviously, on our students, but it will also have an impact in the community, because things that would not be being paid for or would not be being purchased, that's going into the community then too. The money's not just being handed to go into a bank account. It
allows you to keep your enrollment numbers up, and keep the teachers employed, to keep the staff on campus and stuff. Yeah, it just mushrooms, doesn't it?
Yeah, when Congress called it when they call it a stimulus package, that is really the ideal way to look at it. That the money comes in and you get it to people who will then spend it or take care of things that puts the money in other people or other organizations' accounts, and then we pass it all along as well. I mean, we have employees to pay, and we have bills to pay. The college, buys a lot of things in the community, so it really is a stimulus that starts, in this case, with the students, but it has a chain reaction that potentially is really impressive.
Tom Kephart, the Director of Marketing and, more importantly, of admissions at our little gem called SC4, St. Clair County Community College. We thank you for your time, And
thank you, Paul.
It's exciting news. It really is, and everybody should take advantage of it. Just go to your website, sc4.edu, and all the explanation will be there, right?
It is right there. And all of our updates, things that have changed because of this are on the website as well. But specifically with this, it's sc4.edu/cares.
Okay. Thanks, Tom. We'll check in soon with you again. Thanks for your time today.
Thank you, Paul.
Yep. That's about it for this edition of the Focus program. Thanks very much. We're so glad that we could finally give somebody some good news on this program. It's been pretty heavy the last few weeks, but I think things are starting to turn around. Until next time, I'm Paul Dingaman. See you soon.
Thanks for watching Focus with Paul Dingaman. Focus is produced at the CTV Community Television Studios in St. Clair. For over 20 years, CTV has captured the moments that matter to our community.